Chapter 7. Marijuana Patients Battle for a Kidney Transplant. We sat down with a medical marijuana patient who is fighting a battle with both her health and her healthcare provider.
My name is Amy Valerie Nicole Montano. I'm from Vacaville, California, and I'm 44 years old.
Amy has endured numerous surgical procedures over the span of her challenging life.
I had a kidney transplant on December 4th, 1987, one cadaver kidney. I had half of my bladder removed. I've had my intestines reconstructed as a child. I've had C-section, CAPD, which is continual ambulatory peritoneal dialysis. This is my third time, 2 times before I got my transplant, and then this is the current one. What else have I had? I've had my gallbladder removed. I've had my kidneys removed. They took those out 2 years into the dialysis beginning.
Throughout Amy's life, doctors have prescribed dozens of medications for her, some of which have caused her great harm.
With the transplant, I was on Imuran, cyclosporin, and prednisone. Those are triple therapy steroids. And over 7 years, they started doing severe damage to my body. I started first with heel spurs and plantar fasciitis in my feet. Then I started getting
Chapter 6. Marijuana and Cancer. Is it a cure? Numerous recent studies have revealed a link between chemical compounds in marijuana and their ability to halt cancerous tumor development.
In the past few years, we've seen an explosion of interest and research in the potential of cannabinoids as anti-cancer agents. In the lab and in animal studies, we found that cannabis can kill breast cancer cells, gliomas, or brain tumors, as well as skin cancers. So it has amazing promise as a potential anti-cancer agent and will be explored obviously by the pharmaceutical industries in that. THC, as you know, is the main defining component of cannabis. That's the one that gets you high or is psychoactive. But there are other cannabinoids that are increasingly being recognized as important as healing agents and also having anti-cancer properties. And one of those is cannabidiol, or CBD, which is receiving a lot of attention these days. CBD tends to counteract the side effects that THC produces. At 10% or higher THC levels, people experience increased heart rate, elevated blood pressure, and sometimes anxiety. And CBD tends to counteract each of those, giving you a more stable, enhanced sense of well-being without the erratic highs and lows. It also enhances the healing effects of THC, which means that you get more than the sum of the parts.
CTU visited a leading research team in San Francisco, California, who together has been studying the effects of cannabis and cancer for over 15 years.
My name is Sean McAllister. I'm a scientist at California Pacific Medical Center Research Institute, and I am a molecular pharmacologist. And lately I've been focusing on cancer biology, specifically because I'm interested in cannabinoids. Well, the most
Chapter 6. Marijuana and Cancer. Is it a cure? Numerous recent studies have revealed a link between chemical compounds in marijuana and their ability to halt cancerous tumor development.
In the past few years, we've seen
important finding for us to date is that we discovered that one of the second most abundant compounds in cannabis, called cannabidiol, actually has direct anti-tumor.
Yeti Farms Pancake House. I know it's kind of an odd term, but our head purger, head extractor, and general manager of our extraction side of our business, DJ Lund, is in here when he first started, and he was running all these ovens at once, and there's 5 shelves in every oven, and there's what, 3, 9, there's 11 ovens in here, so there's 55 slabs of shatter that the poor guy's working on at one time. And if you can imagine trying to take 55 slabs out as they're purging, throw it onto here, let it cool down for a moment, come to the edge, do the trick, peel, and do the flip, and do that 55 times every 3 hours. He never quit. So I came in, watched him do it one day, and I was like, oh, that looks like a pancake house. You just non-stop do pancakes. So that's what we came up with and started laughing. Now it's called the Pancake House.
Chapter 3, Endocannabinoid System. Why is marijuana effective? For years, cannabis was used medicinally without a clear understanding of how and where it acted in the brain and body. Now, several decades of research have led to a better understanding of how cannabis works, allowing scientists to harness the therapeutic effects of its main mind-altering ingredient, or THC, and to extract useful constituents such as CBD or cannabidiol. Remarkably, the human body makes its own versions of these ingredients called endocannabinoids, which help regulate almost all brain and body processes.
The endocannabinoid system is involved in the regulation of multiple physiological processes in the body, including pain perception, appetite control, temperature regulation,
Alright, so let's talk about step by step what you're going to need to do to grow your own herb, right? First things first, very important, what do you want to grow it, right? I personally don't like grow tents. Every time I've used a grow tent, every time I've had someone use a grow tent, heck on earth just comes, okay? I don't know why, it gets too hot, it's too cold, mites hit, I don't know. I personally like just to grow in a room, okay? If you notice, I like a room. If you don't have ability of a room, use a closet, okay? Closet grows are very effective actually. They're closed off for people, put a lock on them, they're awesome. If you do a room, paint your walls, sanitize it, vacuum if you have carpet, very important. Also put plastic down, linoleum, that helps. And then after you've answered these questions, right, answer question 2. What am I using for a light source? Okay. Now take in mind, if you have a very small site to grow, you don't need a 1,000-watt light. You're going to burn your plant. You can start with a 600, 450. That's okay. It's perfectly fine. Once again, I suggest you start with 315 CMH. They work great for veg. They work great for flower. You can get different bulbs for different frequencies. It's a great light. Saves you a lot of power. So after you figure out what light you want, once again, I suggest go simple and cheap, okay guys? You don't need to be playing with the big boys, right? From there, find out if you want to go seed or clone. If you don't have seed, then find your nearest clone. Buy a clone. Now, clones are super easy. I would say if you really just want to grow for yourself, just go with the clone. Seeds take a lot more time. Seeds take another 3 weeks. You have to sex them. So these are all female. These are pre-sexed, right? These are female clones. So from there, you can really just plant it. Now, a clone, if you get a cutting and you do your own cloning, it's going to take about 7 to 10 days to get roots. If not, you're going to want to get your clones already established, okay? They're going to sit in these blocks for about 4 weeks. You can go longer, you can go shorter. Now, 4 weeks, actually about 2 weeks, you're going to want to start giving them nutrients. Now, these are young babies, so right now they're getting very little nutrients because they're young. Think about it. You can't give a toddler steroids, you know, it blows his heart up. So these are babies. So give them very light feeding. If your plant's dying, there's a good chance you're not. You're feeding too high ppms. Check that. Or use simple feed. I suggest just use simple feed, guys. It helps. Or use good soil. It makes your life a lot easier. So after that, let's say 4 weeks later, this is what you want a veg plant to be, okay? This is a healthy veg plant. Right?